giant cell tumor, or also called osteoclastoma. What is the incidence of giant cell tumor? Giant cell tumor is a common primary bone tumor, which may be benign, completely benign, or locally malignant, which means produce direct spread only, or may be frankly malignant with direct blood and rarely lymphatic spread. The tumor usually occurs after the age of epiphyseal fusion, usually the commonest age between 20 to 40 years. And any bone tumor arises after the age of epiphyseal fusion usually arises in this part of the bone, in the end of the bone, which means epiphyseal. And the tumor usually occur as usual, the commonest site for all bone disease, around the knee, which means epiphysis of lower part of femur or upper part of tibia, or also common giant cell tumor in the upper end of the upper limb and the lower end of the upper limb, which mean upper humerus and lower radius. Osteoclastoma may also occur in the mandible. The tumor usually and slightly more common in male. What is the predisposing factor for giant cell tumor or osteoclastoma? The patient may connect the incidence of osteoclastoma with trauma. The patient tell you that I received tumor in this area and this trauma leading to this swelling. But actually the trauma has no relation to this swelling. And actually the trauma calls the attention of the patient to the already present tumor. What is the pathology of giant cell tumor? The cell origin. The cell origin is uncertain, but histologically the tumor show many giant cells. Many giant cells similar to the osteoclast. Therefore, in the past, it was believed that the origin of the tumor from osteoclast, and therefore it is called osteoclastoma. But nowadays, this not accepted, and the cell origin of the tumor is unknown and uncertain. What is the commonest site of the tumor? The tumor usually occur, as we said before, in the epiphysis, eccentric, in one side of the epiphysis. As we said, mainly around the knee, epiphysis of lower part of femur or upper part of tibia, or upper humerus or lower epiphysis of radius, and they may occur in the mandible. Gross picture: the tumor causing bone expansion, and during expansion of the tumor, the cortex becomes very thin, and this gives a tumor during palpation the sensation of eggshell crackling sensation. The tumor is separated from the medulla by reactive tissue called operculum or medullary plug, which separate the tumor from the medulla. Absence of this operculum or medullary plug suggesting infiltration and disappearance of this operculum, which means frankly malignant transformation. This area which separates the tumor from the medulla is the operculum or medullary plug. This is the operculum and the medullary plug. The tumor, as we see, respecting this cartilage. Respecting this cartilage, what is this cartilage? It is the articular cartilage. And because the tumor respecting the articular cartilage and doesn't infiltrate the articular cartilage, therefore the tumor and the swelling does not infiltrate the adjacent joint. In cut section, this is a typical tumor. In cut section, there is localized, soft during palpation, soft, friable, well-defined swelling with no cartilage or no new bone formation. No cartilage, this excludes chondrosarcoma. No new bone formation, this excludes osteogenic sarcoma, which is characterized by new bone formation. There are fibrous or bony trabeculae dividing the tumor into unequal compartments. These unequal compartments appear in X-ray, like rounded or oval or irregular compartments. Appear in X-ray as soap bubble appearance. Typically, the cut section shows this color, which is brownish or brownish red color, and the cut section show areas of hemorrhage and degeneration. Microscopically, the tumor composed of two elements: cells with single nucleus, rounded or spindle-shaped mononuclear neoplastic cells. This is the neoplasm, which is the spindle or rounded mononucleated single nucleus. This is the actual neoplasm, and scattered in this tumor multi-nucleated reactive cells, giant reactive cells similar to the osteoclast. Therefore, in the past, it is called osteoclastoma, and in the past, it was believed that the origin of the tumor is osteoclast. But nowadays, osteoclasts are believed nowadays are reactive cells by the bone, which cause bone resorption and bone destruction. The blood vessels. The blood vessels, if the tumor is benign or locally malignant, as any benign tumor or locally malignant tumor, the blood vessels are well formed and they never infiltrated or invaded by cells, because malformed blood vessels infiltrated by tumor cells is feature of malignancy, which occur in sarcoma, osteogenic sarcoma, or giant cell tumor with frank malignancy, frank malignant transformation of giant cell tumor. What are the pathological types of giant cell tumor? The tumor present with different degree of aggression, from totally benign non-aggressive tumor to locally malignant tumor, and the worst is to frankly malignant tumor. Aggressive tumor depends on the number of these spindle-shaped cells, which show atypical morphological changes with abnormal mitotic figures, and the features of malignancy like pleomorphosis. Therefore, the number of spindle-shaped atypical cells determine the degree of aggression. The tumor may be primary malignant giant cells with liability to give metastasis in the lung in 5% of cases. This is called the primary malignant giant cell. If I said the primary, this means there is second. Yes. Secondary malignant giant cells occur due to recurrence after complete excision of the tumor or treatment of this tumor by radiotherapy. Recurrence of this tumor with manifestations of malignancy is called secondary malignant giant cell tumor. Therefore, secondary malignant giant cell tumor occur in recurrence after surgery or radiotherapy. Radiotherapy play an important role in treatment of this tumor because giant cell tumor is radio sensitive, and radiotherapy may be used to treat giant cell tumor if the tumor is inaccessible and can't be removed surgically, as osteoclastoma of vertebral bodies. This is the first part of osteoclastoma or giant cell tumor. We will continue in the next video. Thank you for good listening and good luck.